An obesity medicine doctor's take on microdosing GLP-1 medication. That is what we're going to talk about today. Hi, and welcome back to my channel. I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. So today I'm going to share with you my thoughts on microdosing GLP-1s because it's all over the news, social media, and what does it mean? What do I think about it? Do I tell people to do it? So let's get started. First of all, there really is no formal definition to microdosing. Basically, it's taking the smallest or even below the smallest amount of a GLP-1 medication. So if you were somebody who is on, say, semaglutide, and it starts at 0.25 milligrams, you would either stay there or you might take half that dose, or there's all the different ways to do it. But basically it just means instead of the normal, titrating up to the highest dose as we usually try with the GLP-1 medications because the results are dose dependent and people are going to get the most weight loss in general, the higher up they go on the medication. However, there is this idea that, hey, can you get some of the benefits of this medication? Maybe you don't have, maybe you're not in that category of people who need to lose 10 to 20% of their BMI. Can you also get some of the benefits of it without doing that type of regular dosing? Now, I will say also there is not a robust body of research on this, right? So this is also, obesity medicine is a very new field of medicine. So there's lots, and it's very exciting. So there's lots of ideas, there's lots of philosophies, and I'm just going to tell you my thoughts as somebody who prescribes these medications all the time on microdosing. Just to start off, the GLP-1 medications are extremely helpful for weight loss, but they are also extremely helpful for a lot of other things that we didn't really know about until we started using them to this greater and greater effect. And I've made a bunch of videos about that. So you'll see, I'll link them down below, but it's about like GLP surprises, like good surprises, right? Like not the side effects, but like the good surprises. So you can definitely check those out. But essentially, there's so many things that they help with in addition to weight. So alcohol cravings, addiction in general can be very helpful. There's questions about, does this improve quality of memory, or does it help with Alzheimer's? Does it help with autoimmune and is there an anti-inflammatory component? A lot of people who have like psoriatic arthritis, rheumatoid arthritis, they start taking this medication and they seem to feel better. Excessive overeating conditions, like combating medical weight gain. There's so many things that we are learning about just in addition to diabetes and excess weight or a higher BMI that these medications seem to help with, which is really incredible and still being researched and looked at. I also don't want to shame anybody for using for having an idea about potentially using something for cosmetic use. I mean, I really think that there's also this idea among some people that like you shouldn't want to look better, or if you're using these medications to look better, like that there's something inherently wrong with it. Like wanting to look better is not a crime, right? Like we have so many things that we do, the beauty industry, like hair care, dermatology, cosmetic dermatology, plastic surgery. Like there's so many avenues that we use because we want to, right? To look a certain way. And so I'm definitely The point of this video is not to shame anybody for wanting to look better or for telling them that that is somehow not like a good reason. Like, people have many reasons for doing things. We just want to make sure that people aren't being irresponsible or unhealthy or unwise or somehow harming themselves, right? And also, when you talk about microdosing, there's a lot of like elephants in the room. Like, the question of like access, like, how are you purchasing this medication? Is it wasteful? There's a lot of costs involved just with getting the medication. I suspect that a lot of people who are doing this are using compounded medications, which we all know my thoughts about this by now. So, and if you don't, there's lots of videos on it. I don't prescribe it. I don't think it's safe or effective. But so I'm not going to really touch on that because it's not really the point of this video. So let's just go to a place of like a theoretical exercise where like access, safety, cost is no issue for microdosing. It's available. And the question is, really, should somebody, if somebody's looking to lose 5 to 10 pounds, would microdosing in this theoretical exercise like be helpful? And my issue with that scenario for people who are just looking to lose a small amount of weight is that if you microdose, I do feel like it is going to prevent you from doing the deeper and more rewarding work of lasting change. And this is my whole career as a doctor, is trying to get people to do the sustainable change and not the quick fix, right? So microdosing would be the quick fix. But I am very certain if there's nothing medical going on, if there's no like medication interactions, if we kind of ruled all that out and someone really wants to lose 5 or 10 pounds, like there's usually 100% other ways that they can make that change if we dig a little bit deeper. And of course, the question before that is always like, why do you want to lose 5 to 10 pounds? Like, why is this important for you? Do you like your reason for that? Or is this something like you feel like you should do because a lot of other people thought you should, but you actually, if you think about it more, like you don't actually care that much, right? So you really want to like your reason why first. And then the next question is, okay, if somebody's looking to lose a very small amount of weight, 5 to 10 pounds, for example, the question is really like, how are you eating? What are you eating? What are the habits that, if you could wave a magic wand, you would really take out of your life? And when you clean that up, when you fix that, you get a much more rewarding change. Now, it is not as easy as jabbing yourself with a needle. I totally get that. But even if you're just microdosing, you're still taking a medication. There's still risks of side effects. You have to be on it forever. Like there's also, there's pros and cons to each. But I just feel it's similar to how I think about some medications for mental health. There's certainly many people that benefit from medications for mental health. So I'm not saying that they're bad. But I think there's this kind of gray zone of people who are doing well and they just kind of want to take the edge off, or there's not like a true medical indication, but they want to feel better. And it's harder to change your job, get rid of your bad boyfriend, stop drinking. Like there's a lot of other changes that would be external changes that would be more helpful and more rewarding. And what I really don't like to do is make a bad situation more comfortable for people, or have them kind of not confront things that they need to confront to change and grow, essentially. And so much in that same vein, I do feel like microdosing could very easily prevent you from doing the very helpful and real and life-changing work to make the changes that you're still going to lose the 5 or 10 pounds. But one of them really has, like, when you are doing the harder work, you're really growing and developing and evolving. And if you're microdosing, you really miss out on that. So that's really the big problem I have with it. Again, just to recap, there's not a lot of research about it. These medications, the GLP-1 medications, can be extremely helpful with many different conditions that we're still learning about. There's nothing wrong with wanting to look better, right? Everybody has their own ideas about that, but you just want to make sure that you like your reasons and they're not like somebody else's reasons that you're taking on because you feel like you should. You want to make sure you like your own reasons. Microdosing, brings up a lot of other issues like access, cost, compounding, like safety, right? I'm not going into those today because we all know how I feel about that. But just in theory, if you weren't thinking about all that, the main issue I have is that it really prevents somebody from making the changes that are ultimately going to be more helpful, more beneficial for their long-term health. So I'd love to know what you think about microdosing, if you've tried it, if it worked for you, what your thoughts are. Thank you so much for watching. Go ahead and subscribe to my channel. It's the place for medically based answers to your weight questions. And of course, if you want to work with me directly, I do work with people around the world as a life coach to help people with the non-medical aspects of their weight loss as well. So I'll leave all that info down below. Thank you so much for watching, and please be well.